Hi, I'm Linda Weiner, and welcome. I want to talk today about Sensate Focus Touch, what it is, why it works, and how you can do it. Sensate Focus Touch is a series of touching opportunities that form the basis of sex therapy. So what Sensate Focus Touch does is it helps people, especially people that have some anxiety or haven't been physical with one another for a long time, it helps them reestablish a comfortable relationship to touch. So with Sensate Focus, it limits the pressure on the individual or the couple to look forward to it or see it in any particular way or get aroused by it or please their partner. It's basically to learn the architecture of sexual interest and arousal. What does Sensate Focus do? So it helps people reconnect to one another. It helps people feel like they're in their body in a relaxed state. It helps them learn to turn off the busy mind, which gets in the way of sexual functioning. And it helps them feel closer and more bonded with one another. Another positive that is gained from doing Sensate Focus is without pressure and with learning to turn the mind off and be in the body, there's a state of relaxation which ultimately leads to sexual tension and sexual interest. Let me tell you a little bit about why it works. In order for there to be a sexual response or sexual interest, the mind, as I mentioned, has to be turned off. Distractions, such as, am I doing okay? Is my body responding? How is my partner feeling about this? Those distractions need to be addressed because we're looking for a quiet mind, and every time there's a distraction we want to be back in the body in a relaxed state, and it works just the same way as every other natural function. So for example, falling asleep, if you're tense or distracted about something, it's difficult to fall asleep, so they tell you to count sheep. At first I thought, well, counting sheep might be about boring you to sleep, but no. It is an alternative focus to worrying about how awful tomorrow will be unless you get to sleep pretty quickly. So you're counting sheep, so you're not worrying. If you're not worrying about tomorrow, then your adrenaline, cortisol, stress hormones are reduced, and you can slide into the state in which sleep is possible. The same thing is true with Sensate Focus. If you are focusing on an alternative focus rather than is this working and how is my partner doing, the alternative focus is sensation, and I'm going to talk about that in a minute. So you're going to focus on temperature, pressure, and texture. Every time your mind goes to something that might be anxiety provoking, you turn it back to something that's a neutral alternative focus, like sheep is, for getting you into the state in which you can sleep. So this is as I said, the architecture, and why it works is because anxiety, distraction, and watching, spectatoring, not being in your body, are the three things that interfere with non-medically oriented sexual difficulties. Even if the person has a medically oriented sexual difficulty, like it's compounded by a medication or depression, Sensate Focus can be very effective in moderating the effect of the diminishment of sexual interest or desire caused by the state of affairs, and is often contributed to, even if it started out as an organic problem, the couple dynamics and the person's anxiety creates another layer of difficulty. So it works at any rate. So another component of sexual difficulties, either within the individual or in the partner relationship, is pressure. Many times I see couples where one person has a higher sex drive than the other, and they feel a lot of pressure to meet the expectations of their partner, and so they begin to be anxious or feel pressured, which is the antithesis of feeling relaxed and connected. So it reduces, Sensate Focus Touch reduces partner pressure, because both people are supposed to touch only for themselves without concern for the partner. And there's no sexual interaction that follows. This is just building up a comfortable relationship that where sex isn't expected, arousal isn't expected. You're just learning what to do to turn off your brain and be in your body and deal with distractions. It is building the foundation. The other kind of pressure is the pressure people put on themselves. Like, I really want to have an orgasm. I really want to learn how to do that. So they are pressuring themselves to perform. And sex is the one thing that works when you're not working at it. And when have you ever had a good time at a party if you're watching and assessing and asking yourself, am I having a good time at the party? So no, it's about turning your attention inward, turning off your mind, being in a mindful state so that there is no pressure, the anxiety is reduced, and the scene is set for the ultimate move into where we're actually going. Where we're actually going with Sensate Focus is turning off the front part of your brain, the part that we use for just about everything, and being in the back of your brain, the primal brain, where sex happens. So I liken it to getting to the experience of being in the shower, getting the temperature just right, putting your head back in the shower. And what happens is often there's just this amazing feeling, and even uttering an, oh, that feels great to yourself. And that is a state of mindful, being in the body, being in sensations, and that is the place that Sensate Focus is ultimately going to bring us. This part of the brain is turned off. The back part of the brain, where sex and feelings are located, physical feelings, somatic feelings, the body and the brain, the right part of the brain, are activated. So we're moving from worry and pressure and anxiety and distraction and all the other factors I mentioned into a state that allows for the natural function of sexual interest, arousal, and response to happen. So now that we have an underlying idea about what it is and how it works and how come it works, let's talk about how to do it. So I'm going to be giving instructions as if you, the listener, are the client couple. So let's say Jane and Don. So Don and Jane, I'd like you to take out your calendars and schedule a time. Actually, I'd like you to schedule a couple of times a week to do the touching opportunities. And I'd like that to be not near bedtime, and I also suggest that you don't turn on the TV before you decide to do it because you might not get to it. So at that appointed time, I'd like you to meet in the bedroom, some lighting on, not interrogation style. And I'd like you to lie on the bed in any position that's comfortable. And before you do that, you're going to flip a coin to see who goes first, who's going to be the toucher and who's going to be the person touched. So flipping a coin, okay, Don, you're the toucher first. So with your hands and fingers only, this will be nonverbal. This will be touching all over the body without touching breasts and genitals. You will focus on these things for yourself, not to please your partner, turn him or her on, or get the job done. So basically, it's all about learning to focus in on sensations. And the sensations that you're going to feel as you touch your partner's body is where are they warmer? Where are they cooler? Where is their skin a little rougher? Where is it smoother? When you use a firmer touch, does it feel different than when you use a lighter touch? Every time your mind moves to something else, am I doing this right? Does Linda know what she's doing, giving me these suggestions? You're going to simply refocus on temperature, pressure, and texture. Texture of hair and skin. As I mentioned, the pressure, does it feel different if it's firmer or lighter? And texture of the hair. How does the hair on the head feel compared to maybe a beard that someone might have, or the hair on the legs? And it's non-evaluative. So if you're touching a partner that you have an expectation their legs will be smooth and they're not, your response is not going to be judgmental. Oh God, they didn't they didn't shave. It's going to be what it is, just what it is. Prickly, sharp will be the thought that you have about what the sensation is that you're experiencing. So moving all over the body in any way that's comfortable, focusing on those sensations and bringing yourself back from distractions. What your partner is doing is she is experiencing the touch for whatever it is for her. So wherever your hands touch, she's going to be deciding or thinking about is it warm, or is it smooth, or does it feel different when my partner uses a firmer versus a lighter touch? And you're going to do this long enough to get over any initial discomfort, which it might feel awkward initially, and not so long that you're tired or worn out. And then you switch, and your partner touches you same way, head to toe, front to back, avoiding breasts and genitals, focusing on their experience of temperature, texture, pressure, and bringing themselves back as they did while you were touching them, bringing themselves back to whatever the experience is without judgment. So usually it's 5 to 15 minutes, touching long enough to get over the discomfort, not so long as you are tired or worn out. So I did not mention that this should be nonverbal, because if you start talking to each other, you're going to be in this part of the brain, and our goal is to get to the back of the brain, the primal brain. So you might giggle a little bit initially, it might tickle a little bit initially. Did you know that you really can't tickle yourself most of the time? It's about social anxiety. So just allow whoever is ticklish to put their hand over yours and let you know they need a little more pressure, or move your hand. And as a matter of fact, that is what we expect each of you to protect the partner from doing anything psychologically or physically uncomfortable while they're touching you. And if they should move your hand, think of it as a compliment. They're letting you know that's too much for them right now. They're being vulnerable. It's not a criticism. So after the touching, 5 to 15 minutes each, generally speaking, you lie together, just relax for a few minutes, and then get up and write down some notes about the touching. Not whether you liked it or not, that's evaluative, but what you experienced. Here are the things that you will be asked if you work with a sex therapist. Were you able to do the touching? Were you able to focus on sensations, and what were they? What distractions did you have? And were you able to refocus? That is the architecture that we will build on, and that is the beginning step. So most times people will tell you, oh my gosh, I was so anxious about doing it, I avoided it till the last minute. But you know what? I felt really relaxed and connected when it was done. Okay, so that's step one. And generally, couples will need to do that 2 to 4 times. And then moving on to the next step, which would be breasts and genitals on limits. So including the breasts and genitals as any other part of the body. Not, okay, we're now on to the good stuff, let's stay there. But touching the breasts and genitals, moving elsewhere on the body, coming back to them. And the focus is on how you experience the sensation. So it's not about turning your partner on or getting yourself aroused. Arousal might happen, it might come and go, but that's not the point of this. The point of this is to begin to get relaxed with touch and with communicating when that touch is problematic in some way, shape, or form by moving the partner's hand. So including the breasts and genitals, focusing on the sensations and not trying to turn your partner on or make anything happen. And so then switching, again, one is touching and the other is experiencing the touch. So the focus is on whoever is being touched or touching, experiencing whatever sensations are there, and practicing the techniques of refocusing your attention inwardly. After that, the next step would be mutual touching, where the couple touches each other at the same time without breasts and genitals. And this is kind of interesting in that couples sometimes have some difficulty, or an individual has some difficulty knowing where to focus, because before you were focused on the place you were touching or being touched. Now you're going to be touched and being touched at the same time. So just allowing your attention to float back and forth between those places you're touching and being touched. And sooner or later it'll meld into an experience like I described about putting your head back in the shower. That's where we're going with this. Sort of a loss of thought and moving into experiential, mindful sensation. So the next step is to add mutual touching with breasts and genitals. And following that, the next step is an astride position where the partners have genital to genital contact. And the same idea is, what does it feel like? Not moving toward getting the job done. No insertion, just some way to touch genital to genital to feel what that might feel like. Then insertion with no movement, and then exploring what movement might be like. First with one, setting the pace and the movement, and then the other, and then experimenting with movement between the two. So we're now moving into Sensate Focus 2, where couples begin to show each other what they do like and how they do want to be touched, and giving one another feedback. Because by this time, the anxiety about touching, the pressure about sex, the distractions that cause an inability to be in the body, these are alleviated, and generally speaking, the sexual desire is restored, and couples know how to do this again by doing Sensate Focus Touch and integrating it as part of their sensual and sexual relationship. So I did want to mention that sometimes Sensate Focus Touch does bring up couple dynamics or unresolved issues from childhood or trauma that needs to be addressed with a professional. And I recommend that you be open to knowing about the possibilities of finding a sex therapist through the ASECT website, American Association of Sex Educators, Counselors, and Therapists. ASECT.org is a good place to look for a qualified professional should you need one. But a study done more recently showed that 50% of clients, or 50% of people who tried Sensate Focus, even without a therapist, showed some improvement in their sexual relationship. So my recommendation is that you try it. For more information, please go to my website, sensatefocustouch.com. Thank you.